A common procedure that seems to be getting more and more common for me these days is injecting filler into the upper lip and sometimes the lower lip. It's important to understand that you can't use any filler. You want to use one of the fillers that are thinner so that it's not lumpy. It's a very precise technique, and it's as much art as it is science. The best advice I can give you is be conservative. You can always add more. It's absolutely impossible to have pencil thin lips and get really full voluptuous lips in one session. If you try and put too much of the filler, it just spills over and makes the whole area look fat and I think very unnatural. So there's two different ways. I can inject into the red part of your lip, which is called the vermilion, and sometimes what I'll do is intentionally inject a little higher into what's called the vermilion cutaneous, or the skin-lip junction. The latter way is very helpful when you have lipstick bleed lines because it helps camouflage them. And if you try and inject more into the red, it tends to make the lips fuller. It's very normal to get a little bit of swelling afterwards, so I always tell my patients, try and forget about it for 2 weeks, because the two sides of your lips will never swell exactly the same, nor will your upper and lower lip. So once it's put in, if you like the way it looks, if you have time you can ice it, you certainly don't have to afterwards, but largely forget about it for 2 weeks and any irregularities that may appear will resolve on their own. Sometimes too, when I inject it, I always explain that at first, if I were to take the cap off and then squirt it into your palm, it's very soft like a jelly. But when it's injected into the lip itself, initially it can feel a little firm, and although I'll massage it at the time, sometimes there's a little nodularity left. If you, the patient, then massages a little bit at home, that will soften it. So just again, give it some time. You can put on lipstick right afterwards, you can go back to work, I believe you can go back to the gym, you can kiss somebody. It's very hard to ruin it. But these are the things that I like you to keep in mind if you have a lip filler injection.